there are certain trends that you can take advantage of and get to the next level where you're trying to go with your business and healthcare endeavors. First of all, trend one, you definitely want to invest in value-based care models. So if you never heard of value-based care, this is a new way of treating the whole patient. Traditionally, healthcare was fee for service. A patient would go in, see the doctor, and get compensated for it. The doctor would get compensated for that visit. But they're moving toward this new model where they're looking at value-based care. And this model is really focused in on making sure the patient stays healthy out of the hospital. So they're looking at new ways to compensate doctors with new reimbursement models like remote patient monitoring, chronic care management, telehealth options to reach out to the patient, to communicate, to see how they're doing, to manage a chronic condition, which it could be diabetes, could be hypertension, to ensure that the patient is staying healthy at home. And that's just really helping them with behavioral changes over time. The other thing you want to look at is understanding where this value-based care is going. So those are the early stages of where CMS invested in, but then now they're starting to invest in caregivers. So for instance, if you have a loved one or a patient that has individuals in their life to help them with medications or get them to the doctor, there's now going to be ways to compensate these caregivers to continue that effort, right, in helping patients. There's also going to be reimbursements tied to illness navigators, so principal illness navigators. So basically individuals that help patients who suffer from illnesses like cancer navigate the complexities of how to manage that condition for the long term. That's right. CMS is also looking at reimbursing new opportunities to help with what they call social determinants of health, or SDOH. And these are things like surveys to understand if patients have all they need for things that help them with their care, not just with clinical reasons, but things like transportation, food insecurity, and other areas, medication help, things that can help the patient in the continuum of care. And this is where value-based care is going. We talked about this multiple times on this channel, but this is something that we see more and more happening. And when we see CMS putting more and more money into value-based care models, that's the wave you need to ride, because what they get the money from is they've taken it away from fee for service. So we're seeing less and less reimbursement go toward traditional ways of treating healthcare and go more into this value-based care model. And so if you have a clinician or if you're a medical practice owner, you want to make sure you go in that pathway, because that's the way you're going to see the most results. You're going to see greater growth for your company, for your business, and really the best care for your patients, because now you're taking care of the patient's continuum of care. And that's really where it's ultimately should be about, right? So if you're looking at where you need to invest in, look at understanding these models. Go to training courses, right? Go online, watch this channel, find things that can help you understand where these new models are going, because this is really going to change how you view healthcare. And a lot of doctors, unfortunately, are not trained. Other healthcare professionals are just not trained for this type of models, right? So this is something that has to be learned and can be learned, because it's something that intuitive. It's a way for patients to get the best care that they need, because now you're looking at everything that can affect the patients, right? Yes, there's ways to diagnose their illnesses. There's medications they can take. But if they don't have ways to get the medications they need, or they need help with some of their behavioral changes, or there are other issues that they struggle with in their living environment, these are all impediments to helping them get the best healthcare that they can. For instance, I have a story. I know one of my buddies, his mother was suffering from COPD, a lung illness. And, he didn't know what to do and how to help her. But he just said, hey, I'm just going to go all in. This is my mother. I want to make sure she's doing well. So he actually moved her in to his house for the next 4 months. And in that 4 months, he did the basic things, making sure she ate healthy, making sure she took her medication, making sure she made her doctor's appointments, just the basic things. And when he left, she was so much better. She went from having to use her inhaler pretty much all the time to basically almost inhaler free and able to do more and have more life and walk around without getting shortness of breath. And so I just recently talked to him. I said, well, how's your mother doing since she moved out of your house about a year ago? And he said, she's doing wonderful. I mean, the habits he established in those 4 months really transformed how she was taking care of herself and how she's moving forward in the future. So those value-based care models are about empowering individuals like my friend to do things more for his loved ones, right? And helping them get the care that they need. And that's really what this is all about. And the reason why they're investing in it, because they see the numbers. They CMS, the Centers for Medicare and Medicaid Services, they understand that the numbers are there to ensure the patients are taken care of because it saves dollars in healthcare. And so that's something that you want to really look at when you're evaluating where you want to go with your medical practice. Understanding value-based care models are the trend, and you need to ride that trend. One day, I read an article about these new medical billing codes. These codes bridge the old fee-for-service care model, which you're doing now, you do the work, you get paid for it, and the new value-based care models. I researched and read everything I could about these codes and how to use them. I started to implement and follow the guidelines and saw that I was able to generate additional revenue for our practices. Once I implemented and followed the guidelines, I was able to generate additional revenue for my customers. For example, my doctor friend saw his practice begin to generate 6 figures in additional revenue a year. Our healthcare professionals spend roughly 1 hour a month reviewing patient charts on VBC programs. Their staff really does the rest. Their staff verifies insurance, recruits, onboards, and supports patients. The reimbursement from the new codes helps pay for the staff's salary. Here are the common misconceptions we hear from medical practice owners when we present new opportunities to achieve greater success in their career and life. Number 1, they say, I don't have the time to learn this new program. Years ago, when I approached my extremely busy doctor friend about our new practice value creator framework, he was so busy that he had not taken a vacation over a decade. He told me that taking care of his patients was his number 1 priority. Look, I totally understand. It's hard to learn something new. Research suggests it takes up to 10,000 hours to develop a new skill toward mastery. In this nonstop world, who has that kind of time? To make matters worse, the early hours of practicing something new are always the most frustrating and difficult. But after speaking with my doctor friend a little bit longer, he told me patients were his number 1 priority. I knew he wasn't serious. The best thing for his patients was for him to take the time he needed to rest, because a tired mind can never provide the best services. Once he heard that our framework will help him gain more time back, he took the time to listen and learn. Hey, here's a bonus tip. To go faster, you can always hire an outside team to help you with creating your SOPs and recording them. With these easy lessons, you can simply begin to see massive action toward your goals. Keep patient satisfaction high with remote care options. This secret work-related change can reduce the doctor's work level and hours worked. For example, prior to COVID, many medical practices were staffed by a team of dedicated healthcare providers who had built strong relationships with their patients over the years. However, with the onset of COVID-19, these practices were forced to adopt remote communication methods, continue serving their patients while minimizing in-person contact. At first, the transition to remote communication was difficult for both the healthcare provider and their patients. Some patients were intimidated by the technology, while others struggled to express their symptoms and concerns effectively over the phone or via video. But the medical practices who stuck out remote care saw the reputations with their patients increase during the pandemic. For example, a survey conducted by the American Medical Association in 2020 found that 70% of patients who used telehealth services during the pandemic were satisfied with the experience. Another survey conducted by the Commonwealth Fund in 2020 found that 89% of patients who used telehealth during the pandemic said they would use it again in the future. Ultimately, patients reported feeling more comfortable and connected with the healthcare providers even when communicating remotely. This also improved many medical practices' financial stability. Not only were they able to take advantage of new telehealth codes that were there for new revenue, but patients were more likely to follow through recommended treatments and procedures the doctor recommended. This ultimately led to less stress on the practicing physicians. Next up, secret number 2, record all training for your staff. This secret organizational change can increase interpersonal collaboration and increase employee retention. A report by Docebo, a learning management system provider, found that organizations that use video in their training programs see an average increase of retention rates by 25 to 60%. Training videos were important because they provide a visual and interactive way to learn new information or skills. Video training can help individuals understand complex concepts more easily and retain information better than just reading or listening to a lecture. These videos can also be a valuable resource for employees who need to learn new skills or procedures in a timely and efficient manner. They can be accessed at any time from any location, which makes them convenient for busy schedules or even remote work. Moreover, training videos can provide a consistent and standardized approach to learning, ensuring that all employees receive the same information and have the same understanding of procedures. Having a standardized operating procedures can help reduce errors and improve overall performance and quality for the organization. In addition, training videos can also be a cost-effective solution for organizations as they eliminate the need for in-person training sessions that can be used over and over again. Ultimately, training videos help physician owners retain key healthcare talent and decrease operational redundancies. The proposed physician fee schedule has shown that the conversion factor for 2024 will be $32.75. This is down from the $33.89 in 2023. So, what does this mean? That means there will be a 3.34% decrease in your salary from the previous year. This has continued the declining trend in reimbursements that we witnessed over the past few years as the government is seeking to shift funding toward new value-based care models. In fact, AMA President Jesse Ernfield, MD, declared that when taking inflation into account, payment to Medicare physicians has already seen an effective decline of 26% from 2001 to 2023. So, as a physician, what should you do? With these changes, you have two options. First, you can fight the tide, or you can ride the tide. So let's discuss riding the tide first. As we previously discussed on this channel, CMS is moving from paying doctors and nurse practitioners and other healthcare professionals for the treatment or the services you do. So otherwise, this is known as fee for service. But they are moving toward paying you based on the outcome of that treatment or service. This is known as value-based care. Let's discuss the first one, Caregiver Training Services, or CTS. Historically, CMS has held the position that codes describing services furnished to individuals other than the patient without the patient's presence are not covered services. However, in response to public comments and the changing atmosphere, they acknowledge the crucial role caregivers can play in a patient's overall care. So for patients who suffer from conditions like stroke, traumatic brain injury, or dementia, a caregiver can be trained by the treating practitioner, doctor, or nurse practitioner to assist in the care of that patient. A caregiver example can be a family member, a friend, neighbor, or a guardian. For the physicians and other healthcare professionals, this is time they will be compensated for with new CPT billable reimbursement codes. Training furnished by these professionals will be based on an established individualized patient-centered treatment plan or therapy plan of care, accounting for the patient's specific medical needs, individual or in a group setting, and the patient will need to consent, but they don't have to be present. So for example, the proposed codes are code 96202, and this will be where the caregiver will provide behavior management training with up to 60 minutes. And the other code is 96203, which is a 15-minute add-on for the 96202 code. So let's talk about the next code, Community Health Integration, or CHI. This newly introduced code is part of CMS's ongoing effort to reward doctors for involving other professionals to provide holistic patient care. The focus of CHI will be on care management activities that go above and beyond the conventional scope of chronic care management, or CCM. Some typical activities for CHI will be evaluating social determinants of health, taking time to understand the patient's personal history, providing guidance or inspiration, helping patients access community-based social services, customizing health education to fit a patient's context that includes multilingual support, and helping patients navigate through the health system. In addition, third parties with significant clinical integration can execute this program on behalf of the doctor and nurse practitioner customers. This is a game changer, and every practice should take advantage of this now. In terms of reimbursement, it will be similar to CCM CPT codes 99490 and 99439. So you can understand exactly what your monthly reimbursements look like. So CMS will be cutting reimbursement. They released its annual proposed changes to the physician fee schedule, which includes roughly about 3% change in what they call the conversion factor. This will be a decrease of 3.34% from 2023. So this is definitely something that's alarming to a lot of healthcare practitioners out there, because with rising inflation, wage growth, with mid-levels and other healthcare staffing costs going up, this will be a problem, especially relying on thin margins for your clinic or your healthcare practice. And so this is something everybody's pushing back on. Remember, they didn't decrease reimbursement the last couple of years because of the pandemic. But also, this is a long trend of CMS starting to cut more and more reimbursement in fee for pay, because this is the long-term trend what they're going. The last 10 years, I think it's been 22% reduction in reimbursement of fee for service. So we'll talk about why that is. But let's do a refresher, conversion factor. So what is that exactly? So let's talk a little bit about how medical billing works as a refresher. I'm sure a lot of you may be familiar, but your payment is tied into this crazy equation. There's even more that goes into it that's based on geographic location. But just to keep it simple, it's based on what they call these RVUs, relative value units. One is based on your work, one is based on your practice, and one is based on medical malpractice insurance. All that, if you remember your algebra, addition, but really the one that's going to affect it the most is the multiplication, the X, the ones outside of the parentheses, and that's the conversion factor. So anytime that conversion factor changes, that is going to be a detriment to what's going to happen to your payment. Yes, the work RVU, PE RVU, and MP RVU, those are relatively static year to year. They can change based on different procedures or different malpractice, but typically they stay pretty static. Well, that conversion factor is the one where CMS will change from time to time and can affect your payment for any service that you do ongoing. You need to really understand people. People help you scale. That's just a fact. If you're starting a medical practice or any kind of healthcare related business, having people can help double, triple your output, because a person can do more with multiple people involved. So for instance, in our company, when we started it, it was just me and my co-founder, but then we started to add more people to it. So pieces that I was doing before, I started to broker off to other pieces. So I used to do all the invoicing. So now I have a team member that does that. Now that time has freed me up to do other pieces of the business that can help me grow faster. That's what scaling allows you to do. It allows you to free up, delegate to other individuals tasks so that you can focus on continual growth. And that's what you need to do. So leverage people. And it doesn't have to be full-time individuals. They can be virtual assistants. They can be in the medical field, medical assistants, right? Who can help you in various tasks, from scribing to helping with patient intake to helping with patient outreach. Use these resources so you can scale and you can use more of your mind power to understand how to grow the business. Medical practices are struggling, but here's some questions that we answer on a daily basis that can help you as well. As a digital health entrepreneur, we went into medical practice owners, nurse practitioners, doctors, clinic owners all the time and helping them grow their medical practice or clinic. We get a lot of questions, and I want to go through these multiple ones. A lot of these practice owners have thousands of patients that they work with, and this is something that can get you through the hump on understanding how you can grow your medical practice. Physician, nurse practitioner, just healthcare professional burnout. How do I handle burnout as a practitioner? I don't have enough to give to my patients anymore because I'm tired. This is a common problem affecting the medical industry right now. As we all know, pandemic that happened 4 years ago, we're still seeing problems from that. One of the big things has been physician burnout. They were burnt out when they had to deal with patients longer periods of time, dealt with issues with patients unfortunately passing prematurely due to this pandemic. They also had to deal with longer hours and dealing with new workflows and technology that was very frustrating for us to kind of maneuver. Now, 4 years removed, a lot of practitioners are just tired, burnt out, right? It doesn't seem like we've gotten over that. Add to that mixed is a lot of changes in regulations, right? Understanding how to deal with rule changes. First, we had the public health emergency, so rules relaxed. Then last year, those public health emergency rules disappeared. So how do we handle all that? And one of the things that we've seen is that a lot of physicians are looking to get out, especially older physicians, and newer physicians may not want to work for themselves anymore. They rather work for as an employee, but then the job satisfaction is still low. So how do you handle all these different situations when it comes to physician burnout? One of the things that we've seen that's been helpful is physicians need to realize they need what they call a COO, a Chief Operating Officer. If you have a practice, yes, that could be your practice admin, but the practice admin should handle all the operational processes for you. If they're not, then that's not the right person for you. You want to make sure that your practice admin is ensuring front office, back office, interviewing, invoicing is done properly, making sure they handle and work with all the staff, but also vendors that come in to help you grow your medical practice. One thing we've seen time and time again, a lot of physicians, while healthcare professionals in generally are highly intelligent and can learn just about anything, you can't do everything. You are good at taking care of patients, understanding diagnoses, troubleshooting, but more importantly, having the vision of where you see your medical practice going. If you've always had the dream of helping underserved communities, then that should be your vision and how you can grow that. If you have a vision of being high marks when it comes to clinical studies, then you need to stay true to that vision while focusing in on the practice of medicine. But you can't also run it at the same time. So that means having people coming in, whether it's at your practice admin or hiring outside consultants that can help you get you to the next level. Because ultimately, you want to do things that give you energy. If you don't do the things that give you energy, then you will fail time and time again. I've seen it over and over again where medical practice owners who actually are doctors or nurse practitioners are trying to do too many things. They're getting way too into the weeds of trying to figure all this out. I actually had a story of a practice owner was trying to not only run his practice as a cardiologist, which is highly specialized, but he was also trying to build a business and try to do a technology company at the same time and doing sales calls by himself to sell the solutions. Too much. How do you manage your process within your cardiology practice while also trying to be the IT person? It just doesn't match, right? And guess what? If you find the right person to handle that, that will energize you, but also energize that person because that's what they light up to do. There are people who enjoy the deep dives, how to optimize staffing workflows, bill correctly, how to find new revenue opportunities with existing billing. You want to hire those people so you can focus on what gives you energy. If it gives you energy to do some of those tasks, absolutely take that on. But burnout really is about your feelings. If it's something that you dread doing, if you push off, then that's a sign to you that maybe you don't need to do it. And we've seen it time and time again. A great book, The Who, Not the How, by Dan Sullivan and Dr. Benjamin Hardy is a great book to read to give you up to speed on how you can start to level off, how you can delegate some of these tasks that don't give you energy, so that you can do what you do best. And that will help you avoid burnout. If you don't want to suffer from burnout, number one, look inside to understand what's driving you, giving you energy, and do the more of those tasks. Number two, the tasks that don't give you energy, that don't get you excited, you find yourself procrastinating on, you want to find a who that can take that on, because that who will be someone that gets excited about those tasks that you don't get excited for. It almost becomes like a perfect puzzle. Three, you have to trust the process that this person will do what they need to do, and you don't dip back into that because that would provide excuses to do the job and then ultimately get back into that burnout state. So that's how we've seen a lot of practices avoid burnout. Let's go into the next question. One of the things that we hear all the time is doctors have all these great ideas, or medical practice owners, and they want to start something, but they just don't have the resources right now to start these new projects. And it can take years, even decades before they get into it. And ultimately, some of them just give up and they just sell their practices before they even start. We see this time and time again. One of the things that we've seen with a lot of medical practice owners is that they may want to acquire more practices. Let's say, for instance, you're a specialist and you may want to bring in primary care practices to kind of help augment your specialty. Or let's say you want to get into clinical studies. But the challenge is you just don't have the cycles in the day to see patients, run your practice, and start new projects. So how do you handle that? One of the things that we've seen is that medical practice owners need to delegate. They need to understand exactly what are their priorities and then delegate. There's a saying that says, if you do everything, you do nothing. If you have to focus in on something, what we try to do is have quarterly goals, some cases weekly and monthly goals. And in those weekly, monthly, and quarterly goals, we had no more than 3 things we're trying to accomplish at one time. Yes, there's other things I want to do. I want to one day play the guitar. I personally want to one day get better at golf. But right now, I am focused on building my brand for this quarter. I am focused on helping my clients for this quarter. What you want to do is prioritize. Once you kind of have a priority list, then that can help alleviate some of the pain of the new projects. Not saying you will never get to it, but if you put that into a process that you say, okay, Q1, I'm focused on fixing my billing. Q2, I'm focused on hiring the right person to be my practice admin or chief operating officer so I don't have to deal with that. And then month 3, I'm looking to get into this new area. So as you can see, it's a stepping stone. It's a progress. So the first thing is to have a priority list. And that priority list, just like anything, it's a goal, right? We've heard these goals over and over again. How you create them, you want to have goals that are measurable, actionable, that have time limits to it. Definitely agree to all that. You want to follow that process. But for me, it's really more about, what excites you at this moment and focus on that one thing. Right now, if it excites you at this moment to really unpack your billing and making sure you're getting properly reimbursed, then do that. Focus on that. And give yourself, let's say 30 days. By the end of this month, I will have all the billing understood and bring the right people in. And then when you know you're finished is when you felt like it can be packaged up and then it can be run by someone else because you have a sense of how that should work. And then now you can move on to the next task that gives you excitement. But what you can also do, if there's something that's really exciting about it, but you feel like you're just not there yet, put it on your plan of action for the year and maybe get to it in Q4, the end of the year. But at least it's there as a treat, if you will, for that really exciting project. You feel like, I want to get to that, but I may not have the processes in place to get there yet. So that should help you prepare for those new projects and plans that you have for the future, because ultimately it's about what you need to get to the future. And getting excited about that, you want to let your energy guide you in that path, because that will get you to the next level. If you feel like you don't have the impetus to get to the next level, number 1, you want to prioritize, making sure you focus on what you can do. At most, you can only do 3 projects at a time. Number 2, if there is something that excites you, go ahead and put it on your calendar over the next year. So at least it's on the list somewhere so that you know you eventually will get to it. Number 3, you want to have measurable goals, time bound, whether that's daily, weekly, or monthly, or quarterly. You want to make sure you write them down and you stick to it and focus on that. And finally, number 4, once you finish that initial project, you want to make sure you have someone available, like your practice admin or your operating officer, that can take that to the next level and optimize it so you can move on to the next project and you can continue doing more and more exciting projects for the future. The 3 things that are hurting your medical practice's growth and what you can do about them. First, low reimbursements. That's going to happen more and more often now. Secondly, the trend toward value-based care. CMS, Center for Medicare and Medicaid Services, is really pushing that going forward. So you have to be prepared for that. And the third thing is, unfortunately, just a lack of time by the physician to help grow the practice. So how do you combat this? Let's talk about the first one, lower reimbursements. So try these strategies. First of all, do an audit of your medical billing. Here's some suggestions. Look at your accounts receivables to see if there are payments lingering. Sometimes you'll be surprised at how many thousands of dollars are just sitting there. Second, look at your ERA denials and see if you can file an appeal to clean them up. That's really key. Next, you want to also verify secondary payments and see if they are paying out. Sometimes from primary to secondary, there's a delay and you want to make sure they pay out in time. Also, make sure proper adjustments are made at the end of the month across the patient's balance to ensure you have a zero balance. Most cases, you may be missing out on thousands of payments if you don't do this properly. So I have a doctor story. One time we had a client that did not post their payments in time. So what happened was when they finally posted it, they missed the Medicare 90-day rule. So if you don't post a Medicare payment in time, you're going to have an issue with getting paid for timely denial. So you want to make sure you post timely consistently so you don't run into that issue. Next, let's talk about value-based care and how that's hurting your practice right now. So fee-for-service was wonderful, right? You did a work, you got paid for what you did, and that was the rule of the land for years. But unfortunately, by 2030, most of your fee-for-service will be gone, especially for Medicare and Medicare Advantage plans. So the goal is to follow the value-based care trend. Whenever there's a wave, you need to ride that wave. Learn what programs are reimbursable. There's only a select few, but they're growing all the time. So get well versed in them. You need to learn how much you can get reimbursed for. For instance, there's several different programs. They have different ways and different processes to get paid. Understand how to implement them. In some cases, you may need to get a partner who can help you here because you just don't have the cycle, the time, or the staff to do it. You also want to be wary of companies that come in and say they can do it for you, but they're going to capitate your rate, basically pay you less on a per patient basis than what you could have done on your own. So for instance, I have another doctor story. We had a client that was in rural Georgia that was looking to begin a chronic care management program or remote patient monitoring program, and they could have got hundreds of dollars per patient per month. But because it was difficult to get started, Accountable Care Organization came in and said, hey, we'll do it for you. Don't worry about it. And we'll pay you this. Did you know that what they were going to pay them was going to be 1/3 of what they would have gotten on their own? So basically they were going to give up all this revenue for someone to do work and maybe not do it as great as they could do it themselves. So be careful and wary of that. Don't let other companies come in unless you know what your rate is. But more importantly, if you do want them to bring on board, at least you can negotiate if you do it yourself or work with a partner that can help you get to that point so you can negotiate a better plan for you and your practice for the future. Finally, if you're a medical practice owner or if you're a doctor owner specifically, it's difficult to grow your medical practice if all you do is see patients every day, right? So what do you need to do to be successful? We believe the key is to have the right staff in place. You need to understand your current staff's capacity and the roles they play. What are they doing now? Are they good at what they do? Do they enjoy doing it? In some cases, you may realize you may not have the right team now, and you may need to hire additional players. If you are hiring, my suggestion would be to bring on board a recruitment specialist, right? A great staffing company will help provide you with great qualified candidates that you can quickly onboard. Stay away from contingency-based recruitment, as that can end up being way too costly if the candidate doesn't stay on board. Having the right staffing agency can make all the difference in who you bring on board to be successful and continue to grow. Next, you want to start to document all the processes that your staff is currently doing. You want to create what they call standard operating procedures or SOPs around their duties. I've heard this quote, whatever you don't document will not improve. So you need to find a way to document their processes and what they're doing so you can improve upon it and learn from it. Finally, you want to record these trainings around the standard operating procedures. This training will help everyone get up to speed, but most importantly, when you hire new individuals, they can get up to speed quickly. Let me tell you another doctor story. One client of ours we were working with, they had a practice administrator who was responsible for new programs trying to grow the practice. Well, the doctor recently bought a new practice and wanted that practice admin to be over both practices. That practice admin had a lot of autonomy and they were doing a lot of different things. But over time, the doctor owner saw that they weren't getting the payments that they should receive from reimbursements, or the programs weren't growing as fast as they thought they could. Well, guess what? They found out that this practice admin was working a second job. So not only were they managing both practices for the doctor, but they were working a second job at the same time. And the doctor found that out. That's why they weren't able to grow. So you want to make sure you have the right people who have high integrity, but more importantly, going to get the job done. And you need a way to manage them properly with your standard operating procedures. The pain to replace that person took 6 months and cost the doctor owner tens of thousands of lost revenue dollars. So you don't want to be that way. You want to think about how you hire people and bring them on board. If you're a medical practice, have you thought about clinical trials as an interesting new opportunity for you? Well, let's talk about it a little bit. This is something that a lot of practices that I've been speaking to, especially ones that are mid-sized level, several different practitioners, they're thinking about clinical trials as a new opportunity because number one, they're excited about research and what it can do. But number two, they see the opportunity on the financial side and what it can mean for their practice. One of the things that we realize as we're starting to do this more and more with practices is realizing that there's a huge number of opportunities. The pandemic of 2020 has really opened everyone's eyes as the opportunities out there for new clinical trial opportunities, from anything from mRNA that allowed us to basically create a new vaccine in less than a year to help us with COVID, to things like gene therapies using CRISPR technology to help understand how to actually change our genes, is really getting people excited about the opportunities because more and more sponsors or pharmaceutical groups or clinical research organizations are realizing there's a plethora of opportunities out there, but they just don't have enough clinicians. Obviously, there's tons of different clinician sites that kind of create their kind of own research areas, but these individual practices have a unique opportunity because they have access to patients that are unique and different. A big push since last year by the FDA has been looking to get diversity in clinical trials. Again, we saw that during COVID, that it was difficult getting Black and brown populations engaged in clinical trial formats. So FDA and CMS had to be creative in understanding how they can get more people involved in the clinical trial process. That's when things like decentralized clinical trials arose out during the pandemic because it allowed new diverse candidates to participate. And that basically means having a way for patients to participate in trials at home by either sending a nurse or someone there locally to get access to blood draws or to take medications or to get qualification questionnaires. That is still a huge growth area. They're seeing more opportunities for clinicians to get involved in that process. But one of the things that you really want to understand if you're a small practice looking to get into space, you really have to go in with the mindset that this is something I really want to do. Here are some keys that we've seen that have been really helpful. You really need to be passionate about what you're getting into. If you got a passion for trials, so obviously, you know your patient populations and what they need. So if you're a cardiologist, obviously anything dealing with cardiovascular indications are going to be key for you to kind of dive into from a clinical trial standpoint. You really want to be passionate about that. And you want to see what research is in that indication that can help you as you kind of decide what patients you want to participate in this trial. So you definitely want to make sure you're passionate about the research. For instance, I've talked to even primary care physicians who are very interested in certain different areas like pain management, or understanding how they can help in women's health. And there are tons of different trials that are evolving over time. Like I mentioned before, the trials, there's a lot of them coming out because of the new technology. I recently saw an article about how they're helping individuals with sickle cell, helping them with gene therapies actually transform how their blood shape changes form with gene therapies. And it's amazing. And so these are some of the things that we're going to see more and more for the future. So if you're a primary care or specialist cardiovascular, you definitely want to make sure you take advantage of and be excited about some of the areas that you want to select. So definitely the passion is something you want to bring to the table. Number two, you definitely want to partner. You have to find the right individuals that can help you. If you've never done trials before, you need to understand the different levels. Obviously, phase 4 is an easy level to get into because that's basically a lot of registries, what they call registries, ability to be able to understand patients' understanding of where they want to go, understanding what patients are available for future trials. And this is a lot of survey taken with patients, asking them questions about different medications they're taking. Those are like the easiest trials to get involved in because at that level, then basically it's just more around questionnaires and making sure you keep track of the data. As you go up the levels from phase 3 to phase 2, those are more detailed where patients are actually taking medications, right? Making sure that there are any adverse reactions to medications that they take. You want to make sure that there are any issues with them getting support that they need while they're taking the medications and also doing blood draws and other kind of clinical diagnoses. Those are more detailed and more drawn out. And obviously phase 1 are the most highest level, but you're dealing with individuals who are doing research in labs, right? And taking that lab and trying to transform it over into actual individuals, persons who are taking these highly experimental kind of understanding of where they want to go. So when you get started, you definitely want to partner with a group or organization that can help you kind of navigate that process, because as you can see, that you want to get individuals that help you navigate that process, because that can be very complicated as you go through the different levels, depending on where you are. One of the things we've seen work well is what they call site management organizations, or SMOs. These are organizations that go in and kind of help you from soup to nuts, not only help you understand exactly where you are with your practice, where your patients, what they kind of can qualify for, also maybe help with recruiting and those efforts there. And then finally, doing the implementation, actually having nurses do the blood draws, setting up, doing all you need to do to ensure that patients stay in the trial for the long term as they go through the process. Obviously, partner with someone who understands also the payment models, right? Typically, each type of clinical trial is based on a per patient fee. So if the patient's on a trial for 2 years, then you know exactly what you'll be compensated for to kind of engage that patient during that trial. Some trials also pay the patients directly as well. So you want to make sure you understand that model. But then there's also the upfront fees, right? Do you have your site set up? Do you have the right infrastructure in place? Do you have the right data structures? Do you have the technology set up? You want to make sure you have everything you need in order to implement these clinical trials. And a site management organization, that's what they do. They come in and they partner with you to ensure you have everything you need to ensure success of that trial. And again, these trials can last, a year, 2 years, 3 years. And you want to make sure you have a partner that's with you every step of the way as you kind of guide them toward the path of understanding how to get what patients into the trial and understanding how to keep the patients in the trial for the long term. So these are the keys to understanding what the next steps could look like for your clinical trial kind of setup. But one of the things that we saw constantly was when we kind of worked with a lot of practices is they understood what they wanted to do, the passion. They understood they need to partner with site management organization to do all the things they need to do. But the last thing is they need to understand how they're going to find the right sponsors, right? And so the next step is you want to find biz dev. You want to find a business development individual that can help you find the right clinical trials for you. And that can be complicated because there's so many. You want to make sure you understood what direction you want to go in, who you reach out to. There can be different type of trials from sponsors, which are pharmaceutical groups like AstraZeneca, others, or the clinical research organizations who already have the structure in place to kind of get different trials to you because they partner with sponsors on your behalf. So you really want to make sure you have that sales rep or that business development person that can get you the trials that you want and pretty quickly, because typically a lot of these trials are time sensitive and you want to make sure you start the process and get on board quickly so you can move forward in that direction of where you want to go.
I'd like to discuss the role of nurses in RPM and care management, where they fit in, and the value nurses bringing to the space of RPM care management.
Oh, yeah, absolutely. And I was thinking about this and preparing for this conversation. I just realized that nurses are uniquely positioned to take advantage of this opportunity. One of the things, we do work with nurses on our staff, and we have nurses who reach out to patients on our behalf. But things like wellness calls, right? The care you guys go into, the preparation that goes into doing that is so key. The new things around motivational interviewing, right? Understanding how to motivate patients to better behaviors is also a key opportunity for nurses to be involved in that. Care plans, those are things that have been around forever, but definitely something that's taken the forefront when you're looking at personalized health plans, understand patients' exercise goals, understand their motivations. Those are some of the key areas, as well as escalation. So if there's any issues with patients that are either being monitored or need help, how do you have an escalation path? And so you think about those are some base level things that nurses do, but all that is so important because technology is only as powerful as the people behind it. And then if you have nurses that can manage that process, already have your workflows embedded, technology is great as a partner, but it can't lead. People always want to think the technology is the one that makes things happen. No, it's the people behind the technology that make it successful. So if you're a nurse or and working with healthcare organizations, your skill sets will be vital, especially in this new area, the AI that's coming, artificial intelligence. And we maybe we'll discuss that later, but this is going to be a skill set that you can leverage and get to the next level in your career, but ultimately to help patients more in that scale.